Imagine you are standing in your kitchen, holding a familiar little white pill that you have taken every day for years, and suddenly you realize you cannot remember exactly why you walked into the room. You shrug it off as a senior moment, a normal part of getting older, right? But what if I told you that the foggy brain, the sudden confusion, and the frightening gaps in your memory aren't actually caused by your age at all? What if they are being triggered by the very medication sitting right there on your counter? As we get older, our brains become incredibly sensitive to chemical changes, and there is a specific group of popular medications that millions of seniors take every single day that act like a thick blanket of fog over your cognitive abilities. In the medical world, we see patients all the time who are terrified they are losing their minds to an incurable disease, when in reality they are suffering from a reversible chemical side effect. Today we are going to dive deep into the 9 most common medications that can trigger rapid, dementia-like symptoms in seniors. We are going to look at why these drugs affect an older brain so differently than a younger one. And most importantly, I am going to show you how to spot the warning signs before the damage becomes a permanent part of your life. This is the information that could save your independence and your precious memories. So let's get straight into the first and perhaps most surprising culprit on our list. The first group of medications we need to discuss are known as anticholinergics. That sounds like a big, complicated medical term, but its effect is very simple. Anticholinergics work by blocking a neurotransmitter in your brain called acetylcholine. Think of acetylcholine as the fuel for your memory and your focus. It is the chemical that allows your brain cells to talk to each other. When you block that fuel, the communication lines go down. Now, you might think you aren't taking these, but they are hidden everywhere. They are in over-the-counter allergy medications, sleep aids, and even some medications for motion sickness. For a 30-year-old, blocking a little bit of this brain fuel might just cause a dry mouth or a bit of drowsiness. But for someone over 65, whose brain already has naturally lower levels of this chemical, blocking it can lead to acute confusion, blurred vision, and a total inability to concentrate. I have seen patients who were brought into the clinic by their families because they were suddenly hallucinogenic or couldn't remember the names of their grandchildren, only to find out they had started taking a popular over-the-counter nighttime cold medicine. Once the medicine was stopped, the dementia vanished within 48 hours. The second major category on our list is benzodiazepines. These are very popular medications used for anxiety and to help people sleep. You might know them as Valium, Xanax, or Ativan. While they are effective at calming the nervous system, they are notoriously dangerous for the senior brain. As we age, our liver and kidneys slow down, meaning these drugs stay in our system much longer than they used to. Taking a sleeping pill at 10 o'clock at night might leave you chemically impaired until 2 o'clock the next afternoon. This creates a state of chronic sedation that looks exactly like cognitive decline. Patients on these drugs often have a slow, shuffling gait, slurred speech, and a checked-out look in their eyes. This isn't just a temporary fog. Long-term use has been linked in several major studies to an increased risk of developing permanent memory issues. The brain essentially forgets how to function at full speed because it is constantly being suppressed by these heavy sedatives. Let's move on to the third culprit, which is a group of medications a huge number of seniors take: bladder control medications. Conditions like an overactive bladder are common as we age, and drugs like oxybutynin are frequently prescribed to help. However, these drugs are also strong anticholinergics. Remember that brain fuel, acetylcholine, that we talked about earlier? These bladder drugs block it specifically to stop the bladder muscles from spasms, but they don't just stay in the bladder, they travel straight to the brain. Many seniors start taking these and notice that while their bladder is behaving, their mind is starting to wander. They feel spaced out, or find it harder to follow a conversation. Because the change happens slowly over a few weeks, neither the patient nor the doctor often makes the connection between the bladder pill and the memory loss. They assume it is just old age setting in, when in reality, the brain is being starved of its primary communication chemical. Fourth on our list is a surprisingly common one: proton pump inhibitors, or PPIs, used for acid reflux and heartburn. You see commercials for these every day. They are excellent at stopping stomach acid, but when used long-term, which many seniors do for years on end, they interfere with the absorption of vitamin B12. Vitamin B12 is the protective coating for your nerves and your brain cells. Without it, your brain literally starts to shrink and the messages can't get through. A severe B12 deficiency produces symptoms that are identical to Alzheimer's disease: confusion, personality changes, and even irritability. I cannot tell you how many times a dementia diagnosis was actually just a person whose stomach was so suppressed by heartburn pills that they couldn't absorb the nutrients their brain needed to survive. This is why it is so important to have your vitamin levels checked if you are on a long-term stomach medication. The fifth group of medications involves older types of antihistamines. Many people take these for seasonal allergies or even just to help them itch less. But the older generation of these drugs, like Benadryl, easily crosses the blood-brain barrier. In a younger person, it causes sleepiness. In a senior, it can cause a state of delirium. Delirium is a sudden, severe confusion that can last for days. If you are already a bit forgetful, these drugs can push you over the edge into a state where you don't even know where you are. There are much newer, safer allergy medications available today that do not cross into the brain, but because the old ones are cheap and familiar, many seniors keep them in their medicine cabinets, unaware that they are playing a dangerous game with their mental clarity. Moving to number 6. Blood pressure medications, specifically older beta blockers and certain central acting agents. While keeping your blood pressure under control is vital for preventing a stroke, some of these medications can have a side effect called brain fog. They work by slowing things down, including the blood flow to certain parts of the brain if the pressure is dropped too low too quickly. Seniors often have a much tighter window for healthy blood pressure. If a medication makes you feel dizzy when you stand up or leaves you feeling like you are living in a dream world, your brain might not be getting the oxygen and glucose it needs to stay sharp. It is a balancing act, and sometimes the very medicine meant to protect your brain from a stroke is actually making it harder for you to think clearly. Number 7 is a big one. Statins for cholesterol. Now, this is a controversial topic in the medical community, but many patients report what they call statin brain. Since your brain is actually made up of a huge amount of cholesterol, it uses it to build the membranes of your brain cells. Some researchers believe that aggressively lowering cholesterol can sometimes starve the brain of its building blocks. Patients often report sudden, severe memory loss that goes away the moment they stop the medication. If you started a cholesterol-lowering drug and suddenly find that you can't remember where you parked your car, or you are struggling with basic math that used to be easy, you need to have a conversation with your doctor about your dosage or alternative options. 8th on our list are corticosteroids like prednisone. These are powerful anti-inflammatory drugs used for everything from asthma to arthritis. However, they are known to cause steroid psychosis or significant mood and memory changes in older adults. They can make you feel manic, anxious, or profoundly confused. Steroids mimic the stress hormones in your body, and a brain that is constantly told it is under stress cannot process new memories or focus on the task at hand. While these drugs are sometimes life-saving, their use in seniors must be monitored very closely for any changes in behavior or cognitive function. And finally, number 9, narcotics or opioid pain medications. As we age, chronic pain from joints or back issues becomes more common. While these drugs are meant to block pain, they also cloud the entire central nervous system. In seniors, the brain-numbing effect of these drugs can linger for a very long time. They don't just dull the pain, they dull the personality and the memory. Many families think their loved one has sunk into dementia because they have become quiet, withdrawn, and forgetful, when the reality is that they are simply over-medicated for their pain. Why does this happen so rapidly in seniors compared to younger people? It's a concept called cognitive reserve. When you are 30, your brain has a lot of extra capacity. You can take a Benadryl or a Xanax, and your brain has enough backup power to keep you functioning relatively normally. But as we age, that reserve naturally thins out. We are using more of our brain's total power just to do everyday things. When you introduce a chemical that blocks a neurotransmitter or sedates the system, you use up that remaining reserve, and the system crashes. This crash looks like dementia. The good news is that because it is chemical, it is often reversible. If the medication is identified and safely removed or changed, the cognitive reserve can recover, and that dementia can disappear. The danger is that once a senior is labeled with dementia, doctors often stop looking for other causes. They assume the memory loss is permanent and start prescribing even more asterisk medications to treat the symptoms of the dementia, which can lead to a prescribing cascade. For example, a senior takes a bladder pill that causes confusion, so the doctor prescribes a dementia pill, which causes nausea. So the doctor prescribes a stomach pill, which causes a vitamin deficiency, and suddenly, the person is on 10 medications and can no longer function. This is why you must be your own advocate. You must look at every new symptom as a potential side effect before you accept it as a new disease. I want you to take a look at your own pill bottles today. Or if you are watching this for a parent or a loved out, look at theirs. Are they taking something for sleep? Something for their bladder? An old allergy pill? A high-dose statin? If they have become more forgetful lately, don't just blame the calendar. Blame the chemistry. I have seen countless families get their old mom or dad back once the over-medication was corrected. It is like the sun coming out from behind the clouds. What should you do if you suspect a medication is causing these issues? The most important thing is, do not just stop taking your medication. That can be very dangerous, especially with heart or blood pressure meds. Instead, make an appointment with your doctor specifically to do what we call a medication reconciliation or a brown bag review. Put every single pill you take into a brown bag and take it to the doctor. Ask them specifically, are any of these anticholinergic? Are any of these known to cause brain fog in seniors? Can we try a lower dose or a safer alternative? A good doctor will be thrilled to help you simplify your list. One of the best tools for this is something called the Beers criteria. It is a list maintained by the American Geriatric Society that specifically lists medications that are potentially inappropriate for older adults. You can look it up online and bring it with you to your appointment. It is a powerful piece of evidence to show your doctor that you are serious about protecting your brain health. Many doctors are so busy that they might not have the Beers criteria at the front of their minds, so bringing it up can be a helpful reminder. We also have to talk about the natural side of things. Many seniors take natural sleep aids or herbal supplements thinking they are safe, but some of these can also interact with your prescription meds or have their own sedative effects on the brain. Even natural doesn't always mean safe for the brain. Always include your supplements in your medication review. Your brain doesn't care if a chemical came from a leaf or a lab. It only knows that its neurotransmitters are being blocked. I want to spend a moment on the importance of hydration. Many times these medications become toxic simply because the senior is slightly dehydrated. When you don't have enough water in your system, the concentration of the drug in your blood goes up, making the side effects much stronger. Drinking enough water can help your kidneys flush out these chemicals more efficiently, which can clear up some of that drug-induced fog. It is the simplest and cheapest brain protector there is. Another factor is the combination of drugs. Two medications that are safe on their own can become a brain-toxic cocktail when taken together. For example, taking a mild sedative for sleep and a bladder pill at the same time is a common combination that can lead to a massive drop in cognitive function. It's like two different people trying to steer a car in opposite directions. Eventually, the car is going to go into a ditch. The more medications you take, the higher the risk of these interactions. This is why the goal for every senior should be the fewest medications necessary for the best quality of life. Let's talk about the symptoms to look for. It isn't just about forgetting where your keys are. True drug-induced cognitive impairment often looks like a fluctuation in clarity. Maybe you are sharp in the morning but completely confused by 4 o'clock in the afternoon. Or maybe you have good days and bad days that seem to correlate with when you take certain pills. You might also experience sudden changes in mood, like being unusually angry or tearful. If the dementia seems to have come on quickly, over weeks or months rather than years, that is a huge red flag that it is chemical rather than a slow-growing disease. I've had patients tell me, "But Dr. Wagner, I've been taking this same pill for 20 years. It can't be a problem now." But that is exactly why it is a problem. Your body at 75 is not the same as your body at 55. Your liver is smaller, your kidneys are less efficient, and your brain cells have changed their receptor sensitivity. A dose that was perfect for you 20 years ago might be a massive overdose for you today. You have to recalibrate your medications every decade or even every 5 years to make sure they are still appropriate for your changing biology. I also want to encourage you to look at your diet as a way to replace some of these medications. Many people take stomach pills for reflux that could be managed with better food choices. Many take sleep pills instead of practicing good sleep hygiene, like avoiding screens before bed. Many take pain pills instead of doing gentle physical therapy or anti-inflammatory exercises. Every medication you can safely eliminate is a win for your brain health. It is one less chemical looking to cloud your mind. For the family members watching this, pay attention to the shuffling. If your loved one starts walking with small, tentative steps, or if they seem unsteady on their feet, check their medication list immediately. Many of these brain-clouding drugs also affect balance and coordination. A fall is one of the biggest risks for a senior, and many falls are caused by the dizziness or confusion triggered by these very drugs. Protecting the brain also means protecting the body from injury. I want you to feel empowered, not afraid. The medical system can be overwhelming, but you are the only one who truly knows how you feel. If you feel like your spark is gone, or if you feel like you are living behind a pane of frosted glass, don't let anyone tell you it's just normal aging. It isn't. You deserve to be as sharp and engaged as possible for as long as possible. Your life experience and your memories are your most valuable assets. Don't let a popular pill take them away from you. As a physician, my goal is always to treat the whole person, not just a list of symptoms. When we look at the senior brain, we have to be like detectives. We have to look at the sleep, the diet, the hydration, and most importantly, the pharmacy. It is often the simplest fix that yields the most dramatic result. I have seen people wake up after years of confusion just because we changed their allergy medicine or lowered their blood pressure dose. It is one of the most rewarding parts of my job. In the coming years, as our understanding of the brain grows, I hope we will see more focus on deprescribing, the intentional process of reducing or stopping medications that are no longer serving a patient. But until that becomes a standard part of every doctor's visit, you have to be the one to bring it up. You have to be the one to ask, do I still need this? Is this harming my mind? Remember, your doctor is your partner. They want you to be healthy, but they are often following guidelines designed for a general population. Your specific brain and your specific body might react differently. If you advocate for yourself with information, like mentioning the Beers criteria or tracking your foggy moments in a diary, you provide your doctor with the data they need to make better decisions for you. Staying mentally sharp is about more than just doing crosswords or Sudoku. It is about maintaining a clean chemical environment for your brain to work in. It is about protecting your neurotransmitters and ensuring your brain gets the nutrients and oxygen it needs. By being aware of these 9 popular medications, you are taking a massive step toward dementia-proofing your life. Don't let the fear of old age make you accept a lower quality of life. The many senior moments we experience are often the result of choices we've made at the pharmacy, not just the passage of time. You have the power to change those choices. You have the power to protect your clarity. You have the power to stay present for all the beautiful moments your future still holds. I want you to share this information with your friends at the senior center, or your siblings, or your parents. We need to start a conversation about over-medication in the senior community. We need to stop seeing the fog as inevitable. When we share this knowledge, we help everyone live more vibrant, connected lives. Understanding these risks is the first step toward a revolution in senior health. Take a deep breath and realize that your brain is a masterpiece of biological complexity. It has billions of connections and has processed an entire lifetime of information. It is incredibly resilient, but it needs your help to stay that way. Be careful what you put in your body, be curious about every pill, and always prioritize your mental clarity. Thank you for spending this time with me today. It has been a privilege to share these warnings and insights with you. Your health, and especially your mental health, is your greatest treasure. Protect it with all the knowledge you have. I look forward to hearing about your journey toward a clearer, sharper, and more vibrant mind. See you in the next one, where we'll continue to explore how to keep your body and mind running like the masterpiece they truly are. Until then, take care of yourself and take care of your brain. It's the only one you've got, and it's counting on you to keep the fog away.